in reality, does a procedure hurt? You're going to have some discomfort, and a lot of it depends on actually what we have to do. I mean, somebody who comes in who doesn't have any teeth, and we're doing a full arch hybrid prosthesis and placing implants and kit loads, the prosthesis the same day, they're going to have minimal pain. Whereas if somebody comes in and we have to take out 28 teeth and then place the implants after and remove bone and things like that, they're going to have a bit more pain. But from our training, we're used to managing acute surgical pain. I mean, it's what we're good at, is managing that. And usually the discomfort lasts for 3-4 days. Now with some of the newer medicines that we're using, like Exparel, it lasts for 3 days. It's significantly reduced the amount of pain medications that we're giving patients, for these procedures and the extensive procedures with extractions and implants. So, we really don't have too many complaints about, large post-operative pain after this.
I mean, I can tell you just from, some of the cases that we've already worked together. I've been surprised where the patients they were coming to see me at my old office, where I was truly surprised at how good they were feeling and how little pain and discomfort they were having after the procedure. And I think that has to do with surgical technique.
One of the advantages of the implant center is we're probably the only practice in the state that employs full-time nurse anesthetists. And every one of our full arch patients go to sleep to have a general anesthetic to have these procedures done. So they are not awake for the procedure. And like David was saying, we use Exparel, which will sometime get up to 72 hours of pain relief afterwards. And a lot of these patients truly are so excited about this big step in their life and their new teeth that we just don't have a lot of complaints with pain. So they're prepared for it. But I tell patients all the time, I would personally rather have 5 implants put in than one bad extraction, because it's a lot more painful extracting a tooth than doing a dental implant.
It's so nice to know that I truly have my colleagues and our team members, including our staff, that have our backs on all of these patients, no matter what. And are we going to tell you that there is no pain involved with any of these surgical procedures that we do? No, we're not. The truth of the matter is that you will be sore and there can be some pain, because everybody has different pain thresholds, and we all know this. But we're here to take care of you on every level possible. And what I like to tell and discuss with my patients is simply just, okay, so what would you prefer? Would you prefer somebody performing your surgery, designing it at a very high level, who has done an incision 4,000 times, or would you maybe consider going to a practitioner who maybe took a weekend course with a poorly designed plan and might be the first incision he or she's ever done? That's a simple answer. And so that's what I like to let our patients know when they come into the office. But most importantly, the pain control that we do have the ability to take care of is sitting right here in these 5 chairs. And someone is always available.
And I believe, if you have less anxiety and if you feel cared about, I would imagine that your pain threshold would actually increase. We might be able to find some literature on that, but when you're scared, things hurt more.
Yeah.
If you feel like people aren't there for you.
Yeah, no, to add to what he said, the anesthesia aspect of this truly is one of the hallmarks of our profession, the fact that we're able to provide our patients with the most comfortable procedure possible, the fact that we're able to make it more comfortable, we're able to do the procedure more quickly. If we're able to do the procedure more efficiently, I should say, that means that there's less swelling, therefore less pain, and I think that patients overall have a much better experience than they would otherwise by having this procedure done here.
The biggest advantage to our model is the efficiency that we do the procedure and the atmosphere that we do the procedure in, being the OR, being the pain control, being that we've done countless amount of these cases, we're efficient at it. and just to compound on what Stephen said, is less time in the operating room is going to equal less swelling, less pain, and the start of the healing process is going to be much more smooth.
In addition to that, the level of anesthesia training that we also have coming into this affords us the luxury of taking care of these patients in a painless manner. We all know this. But on top of that, we have now gone to a whole nother level of employing these certified registered nurse anesthetists full-time. And they are within our facility full-time. And that adds a tremendous component to our team in the ability to be able to handle these concerns of anxiety. And yes, is it a painless procedure? Absolutely, it's a painless procedure because we can offer that level of sedation to these patients.
You know, a common theme that I've heard from patients is that, you know, first couple of days were a little tough, but I'm so glad I did this.